I'm Von Biggs, and let's queer up health. Congenital syphilis cases surge across the United States, including Florida. Tonight we need to talk about something many people thought belonged in the history books, but it is very much part of our present. According to the recent report from The Hill, syphilis is making a comeback in the United States, and Florida is not an exception. According to the Centers for Disease Control and Prevention, congenital syphilis cases are now 700% higher nationwide than they were just over a decade ago. Congenital syphilis happens when syphilis is passed from a pregnant person to a baby. The consequences can be devastating: miscarriages, stillbirth, infant death, and lifelong medical complications, including organ damage and bone deformities. According to Dr. Khalil Ghanem, a professor of medicine at Johns Hopkins, quote, overall, 10% of patients who are not treated for syphilis wind up dying from this infection. Syphilis is a cruel disease, end quote, but it is also curable. Now let's talk about Florida. Florida reported 235 cases of congenital syphilis in 2023. We have a prevalence rate of 104.7 cases per 100,000 live births, placing our state among the highest in the nation. Beyond infants, Florida has also reported thousands of new syphilis infections across early, late, and unknown stages, showing this crisis extends far beyond pregnancy alone. Syphilis does not appear during pregnancy out of nowhere. It is transmitted sexually, often weeks or months earlier, frequently by partners who do not know that they are infected. Many men never notice symptoms, or symptoms disappear on their own without treatment. Florida does require syphilis testing during pregnancy, not once, but multiple times. The CDC now recommends routine syphilis screening for all sexually active people ages 15 to 44 in high prevalence areas. That includes men, that includes LGBTQ people, and that includes Florida. The interesting thing was that I teach at the Broward College. I go and I talk to some of these students, and we recently went and I tested 101 students recently. We went to do HIV and STI testing, and so many of them come and said, "What's syphilis?" They have no idea. And when we think about syphilis and you think back to the Tuskegee trials, I mean, the things that they've done to our Black communities,
yep.
And a lot of times it's our Black communities that don't even want to be tested for it because of the stigma behind it alone. But I was curious because I'm like, we do require testing for pregnant mothers here. You know, when they come through, it's their first trimester, usually during their second, and in their third trimester, they're tested again for HIV and syphilis and other STIs. But the problem is these mothers that are here aren't necessarily getting prenatal care. Mm. So that's what we're seeing is happening, that people that they're not getting care, or we have maybe undocumented mothers who are giving birth. And I mean, the devastation of a baby being born with syphilis, it's just it's very cruel and sad to think about when you're born and the first thing you're doing is being, jabbed with, antibiotics and things like that they should not be.
And it might have been avoidable.
Right. Very much so.
People just getting tested, etc.
Yeah.
So men are definitely, the cases are rising,
right.
Alarmingly, more for men than they are for women.
Yes.
I mean, just get tested. Add it part of your regime. We're all trying to make sure that we know our status. Throw that into the mix,
Right.
Like, Florida, we love to be number one for just like the sickest stuff. You know what I mean? If we can normalize brunches, we can normalize getting tested, Syphilis is curable. Ignorance is not.
Right.
All right? You know what I mean? Wrap it up, get checked, and keep it moving. The problem with syphilis is that it can stay dormant for a long amount of time. You could also be not showing symptoms for a long time.
Yep.
You can go 90 days in between showing anything. So know who you're sleeping with, boys.
And you can go years without knowing if you've never been tested.
Unfortunately, I think we're going to see a rise in a lot of things because healthcare has been weaponized. Mm-hmm. We just talked about this, and you just mentioned it. I mean, people are afraid to go places in public because they're undocumented, or culturally it's been stigmatized. I'm fine, nothing's broken, don't go fixing it, type of a thing. So we're going to see cases not only at this, but in many things going in the rise because of, especially here in Florida.
Yeah.
They don't want to go to the hospital because they're afraid that they'll either be taken away or their family. There's so much stigma and weaponizing of our healthcare right now, and the doctors are afraid to do anything or say anything. So it's not a good situation in general.
And I just want to ask a question, basically for people out there. I'm pretty sure I know the answer. Okay. if you had syphilis in your 20s, you can get it again.
Yes.
Right? This is not a, I had it once and now I'm
only.
good to go.
Right.
Okay.
Absolutely. And that's a lot of questions we get from the college students is, can you get more than one STI? And I'm like, yeah.
Yeah.
All of them.
Let me
if
give
you're
you a
not-
list.
Yeah,
Let me
right.
give you a list, you know?
Right.
John, were you asking for a friend?
For a friend, we're very close.
Well, I think we do a pretty good job of getting tested for HIV. I know, like in my medical test, whenever I do my blood work, which is like every 6 months or so, I just kind of added into the list for HIV, always just to make sure we know our status. But some of the other STIs that you could get, a lot of times we don't test for them if you don't feel like you have any kind of symptom for it.
Right.
And I can say I really haven't personally looked into syphilis testing, but then there have been times where I watched some old, classical composer movie like Amadeus or something, because Schubert famously died of syphilis, right? And I remember that was the most exciting part of musicology. We're like, oh, they were all having sex. But it's hard to even know if you have it or not unless you test for it, right?
Right.
And it's interesting that they recommended 15 to 44. Have they been to Wilton Manors or South Florida? I think they could probably extend that age from 44 a little bit higher.
Well, I mean, the villages. I mean, come on.
Right.
They were always like number one in like the country when it came to syphilis or gonorrhea or one of them. It was the gambit of STIs that those people were enjoying themselves, and still are. Hey, Billy. Hey, Al. How are you, Al? We love
What's
you.
your loofah color?
And the great thing is, syphilis you can do testing for that at home, just like you can HIV now. I mean, they've got kits out there. I give out kits all the time.
Where do you get those kits?
From the manufacturer, but we provide them when we're out in the community. But you can buy them at a convenience store. I mean,
really?
But the next time you're gonna go get like your physical, just add them.
Yeah.
To the mix. That's it. Don't be afraid of it. Do it. Listen, I go to Mayfair Medical, and every month they treat me for everything. Okay, I'm married. Doesn't matter. I've had the same partner for 10 years. Doesn't matter. The gambit gets checked every single time.
No, that's good to know.
They treat you for everything, or they test you?
No, they test me. They probably treat me for everything too. After one magical weekend, I'll be back there, Mayfair. There is no other queer nonprofit media platform like this in the entire world. I hate you. For our LGBTQ stories by sharing them and subscribing to Queer News Tonight.